Well, we've got Anthony Hopp with us. Anthony Hopp is the Director of Membership Development for Samaritan Ministries. Now, you all know how I feel about Samaritan Ministries. I talk about it on a regular basis. Obviously, this is the health sharing ministry that my wife and I have come alongside. That's what we are using this year. And by the way, just to put things in perspective, my wife and I had two separate policies. Her policy wouldn't take me, and my policy wouldn't take her. So because she went to a cardiologist 6 years ago for nothing, and I have sleep apnea, they wouldn't take me. So we had two separate policies, both over $1,000 a piece after last year. And so we obviously very motivated to move to Samaritan Ministries. But more importantly, our desire was to take the leap of faith and get back to the book of Acts. And that's what we really wanted to do, and are happy that we have done that. So I want you all to take that same leap of faith. You know, we lament, Anthony, over, and welcome. Thank you for being here. I sure appreciate it.
My pleasure. Thanks, Dan.
We lament, all of us lament over Obamacare, and, you know, the solution is real simple. Can we just get away from the government, at least with our health care, allow our doctors to prescribe good health care for us,
right,
and take control of that and do it the way the Lord would have us to do it, and is written in the book of Acts. So that's what everybody needs to do. Anthony, I want to ask you a question that I get that I get asked all the time, and I probably mess it up when I try to answer it. So I'm going to let you do it, and maybe I'll have this in the board, and we'll just push this button when somebody asks me the question. But one of the things that I see that people are concerned about is catastrophic events.
Sure. Right.
And they say, well, you know, I know, you know, maybe they know the percentage of that happening is low, but nonetheless,
Right.
Everybody knows somebody that has a catastrophic event in their life.
Right.
And they're concerned about that. They're
Right.
concerned about that getting paid.
Yeah.
And they're saying to me things like, well, these health sharing ministries don't pay for that, and on and on. I said, no. You don't understand. I tried to explain it. And I want you to give us some of the statistics behind that.
Sure.
With Samaritan anyway.
Right.
I know you're not speaking for all health sharing ministries, but with Samaritan, and eliminate and alleviate their concerns about that.
Sure, yeah. Well, I'll get to the punchline, Dan,
Okay.
and that is that by God's grace, this model has been sufficient. God has provided through His church, even in the big stuff. And I think the reason that's the number one concern, because really if I'm looking into a different model like healthcare sharing, the litmus test is, can it handle the big what if, 200,000, 500,000, 1 million. Just to give you set the table and give some context, our guidelines, which detail out specifically what needs can be shared, we share up to $250,000 per medical expense. So there's no limit with respect to per family or per household, you know, per person, or per year. The only maximum would be that per medical issue. $250,000 is a lot. It's very rare that a medical need goes over that amount. And even when it does, because of reductions with the providers, the amount is frequently reduced back under $250,000. So Samaritan members are not expected to go after these negotiations on their own. We give them a lot of help and a lot of support. And typically we can see about 40 to 45% in the way of reductions, right? Yeah. So if there's any bright spot in such an exorbitant need, it's that typically the reductions are big, and it brings it back under $250,000.
Okay.
So that takes care of a big portion of them. Then there's a small portion of medical needs that still are over $250,000, and for that, Samaritan members have the option to join a program called Save to Share. It's an optional program. About half of the members participate in it.
We participate in that.
Yep, as does our family too. And the cost is very affordable for a family of any size. It's an additional $399 annually. And I set that $3.99 aside to be shared when another Samaritan member has the big one, has a big medical need. Numbers-wise, about 8 to 10, maybe 12 in a given year. So we're talking 45,000 households, only about 8 to 12 medical needs that stay over 250,000.
Right.
In the 12 or 13 years that Save to Share has been in existence, every single medical need that has been presented to Save to Share, by God's grace, has been shared. Brothers and sisters in Christ have come together and they've taken care of it completely. The largest medical need we've seen, about $1.5 million, and after reductions, that became $700,000 and change. Every single penny shared. So I think part of what's at play here, Dan, is that fear drives. Everybody's thinking about the big medical need, and surely we need to be good stewards, but also we have to start considering where is trusting God factoring into this.
Yeah. But, is it trusting God? So to follow through with that fear aspect, is it people say, well, I trust God, but I'm trusting some stranger trusting God, and that stranger is going to pay their part of this, and it becomes a human event that they're concerned about. And so what do you say to that?
I say I understand, because 17 years ago I was in the exact same situation where our family, while it wasn't catastrophic, hundreds of thousands of dollars of medical needs, we were faced with a medical situation where we had several thousands of dollars, and this was only 6 months after having become a member, and our son was suddenly very sick, and it was a trying time, and by God's grace he was healed, but at the end of it, we had a new crisis. We had medical needs ourselves and no health insurance, just members of this. At the time, there were a little over 1,000 households, and I was asking the exact same question. So I've got to trust that these total strangers are going to voluntarily do what they said they're going to do.
Right.
And I'm kind of embarrassed and feel sheepish admitting it, that even though I had been on staff for 6 months, I was scared. My wife and I thought, was fine when it was somebody else. And I had seen the process work. It wasn't like 6 months of success, but now that it was us. But you know how the story ends. Of course God provided, and of course our brothers and sisters in Christ came through, and we were able to pay the providers. But that wasn't even the best part. It was the encouragement, the community, the notes and cards.
And the other thing is that I've told people is that, of course, they're going to come through because that fear also is a fear that I might be in the same need someday. Right. And I want everybody to come through for my family as well. And I think that's an incentive, too, for them to come through. Right. And I think that's and they've always been, I mean, you told me some stories of just under $1 million, over $1 million, and they've always come through.
Exactly.
And have been paid. None of them have ever not been paid in the history of the ministry.
Those large ones, there's not been a single large medical need that has gone unshared, that the members haven't shared. And you hit it right on the head, Dan, that it's like-minded believers who are committed to this concept. Right. And there's also some practical motivation and accountability. If you don't send your monthly share, you're done. Now, there's grace extended, but that's the bottom line. So that, there's a very smooth process. It's not, I think people understand, but it's worth mentioning that it's not a haphazard, let's pass the hat, cross our fingers, and hope that enough people send their shares. Right. We specifically direct the right amount of members to send their monthly share to the person with the need to ensure that the whole thing is shared.
And the monthly share, it's unusual, and I wouldn't want anybody to expect this on a regular basis, but the monthly share has been lower than what people have promised to share, hasn't it, for the last 3 or 4 months?
It has, from November, October, November, December, and January. So those 4 months culminating in a share reduction. The monthly share is the amount, of course, that we as members send. The monthly share in January was reduced by 17%. Yeah. The reason for that was there were more monthly shares than medical needs presented. And while it doesn't happen a lot, we were really praising God, because I think it's indicative of what a different animal this is. Yeah. It's not health insurance. Right. It's community. It's trusting God. And that really was emphasized and exclaimed when God provided that reduction a couple months ago.
It's the book of Acts, folks, and that's how God works, and it's just so awesome. I just wanted to clarify that when Anthony was talking about reduction in the bill and the negotiation and all that, One is, and you did say this, Samaritan is alongside you doing that. And number one, it's got nothing to do with the quality of health care that you receive. Remember, you've already received the health care, but it is the difference. This is what I'm a numbers guy. So to me, it reminds me of how expensive insurance is. And the reason why is because of these added costs that this is considered a private pay. So doctors and hospitals are saying, we don't, we don't have a problem at all reducing our expenses because we've got all these things factored into our expenses that we've got to have in there because of insurance. So it's not, so your doctor is not going to dislike you now because he's been negotiated, he or she has been negotiated with. They're going to love it because they're going to now start to understand, wow, this is a private pay system.
Yes.
So it is. I think that clarification it needs to be made because I don't want people thinking that that it's not that way.
That's good, absolutely. And the idea of being a cash pay or self-pay patient can be daunting initially because we've been so conditioned that, you don't have insurance. If you go into the ER, they're going to let you bleed to death on the floor or something. Right. When in reality, we're seeing the trend shift where providers are increasingly comfortable accepting cash because now they don't have the cost of managed care. They don't have to monkey around with insurance. And the fact that there's no price transparency complicates this whole thing, with the reductions. That's why we see such a wide variance with reductions. So,
Well, I believe that as God continues to grow the ministry of Samaritan Ministries and other health sharing ministries, and God continues to convict his people that this is God's plan and always has been for the way brothers and sisters in Christ are to go about their business, what's going to happen. I think of you saying whatever it was 15, 17 years ago, you had 1,000, there were 1,000 people involved in this. There's 45,000 or whatever it is now. The more that increases, the more doctors and hospitals are going to know exactly what this is all about. And I would suggest and submit that in 3 or 4 years at the current rates that the growth rates are, everybody out there is going to be able to go to their doctor and hospital, and they're going to know about this program, and they're going to embrace it in a powerful way because of the private pay aspect of it.
Yeah, and we're starting to see that where providers are excited because they know that Samaritan members are paying quickly. The extreme example of this is that once in a while a family will receive a bunch of checks for a really large medical need and just take the checks in to billing, sign them over, and the jaws of the staff are on the floor. You got to be kidding. This actually works. So,
that's awesome.
Again, a testimony to God's providing.
Cool. Yeah, that's really cool. In the short amount of time that we have left, tell us a little bit about the growth of the ministry and what your expectations are. And I would assume that you guys believe that God has used Obamacare to raise awareness to health sharing in a powerful way.
Yeah, that would be a good way of putting it. I think it's put healthcare sharing, that this whole Affordable Care Act has made it more prominent. And we've seen in the last several years, 3 or 4 years, 15 to 20% with respect to growth. January, we had a record month with about 3,600 new households joining. And that's to be expected. January, the first of the year, a lot of people join. But then, as we get in later this year, we'll see about 800 to 900 new households a month joining. And we expect that will continue to increase. One, this has been happening 20 years, and so there's a viability issue as people kind of stand back and watch, well, let me see if this really works. So people are more comfortable. They see that it has merit, and the track record is good. And two, people are increasingly fed up, not only with the cost, but seeing my healthcare dollars are going toward things that I don't agree with, supporting garbage. And so people are finding there is a way to know where your money's going, how it's being stewarded, and to be able to minister to a brother or sister in Christ directly.
Yeah, that is great. And that's one of the things that we haven't experienced it, my wife and I, yet. But we have friends in Kansas that have been involved in this for a long time, and they've always shared the stories of the cards and the letters and the encouragement that they've gotten and the encouragement they've been able to give. And so many people that I talk to that have had this for a number of years say the greatest thing is the prayers we receive. We know we're being prayed for, or our child's being prayed for, or whatever the situation is. One quick thing I want to remind our listeners, because I have a lot of small business guys that listen to this program, and large business farm operations and such that listen to this program. And this is a great program for small business.
Absolutely.
And it's something that I wish and hope that small businesses is to have those 3, 4, 20 employees, whatever it might be, that they would consider something like this and it's a great witness and testimony to their employees too.
It is, and we've seen an increase in those groups and organizations realizing they can give a quality health care benefit, save money, and not violate their principles.
Well, that's awesome. Anthony Hopp, Samaritan's Ministry, and folks, I just urge you, would you go to SamaritanMinistry.org, SamaritanMinistry.org, right?
Ministries, SamaritanMinistries.org.
I'm so worried about putting the plural on the Samaritans. SamaritanMinistries.org, SamaritanMinistries.org. Check it out.